Welcome to Women's Health Week. My name is Dr. Jason Felger. I'm a thoracic and cardiovascular surgeon at Shannon Clinic. I'd like to talk today about women and heart disease. First, I'd like to talk about kind of the scope of the problem, or how big this problem is in the United States. Over 400,000 American women suffer heart attacks annually in the United States, and 35,000 of those are under the age of 65. 42% of the women that suffer heart attacks in the United States die within 1 year. Those women that are under the age of 50 who have heart attacks are twice as fatal as men who have heart attacks under the age of 50. And I think the most telling statistic about the severity of heart disease in America in women is that over 250,000 women die of heart disease annually. And that's 6 times more the amount of women that die from breast cancer annually. The people at risk for heart disease is basically every woman, especially after menopause. The protective hormones before menopause, they are protective. But I think I want to address the 3 categories that you can change or at least alter with medicine or with just lifestyle changes. And those are the people that smoke. Women that smoke have a higher risk of having a heart attack, and it's been shown that they have a heart attack 19 years earlier than women that don't smoke. Women that have high blood pressure are 3 times more likely of having a heart attack than women that don't have high blood pressure. And then women that have diabetes are at a 2 times higher risk of having a heart attack than women that don't have diabetes or controlled diabetes. I think one of the things that we are learning through the years is that women don't have the same signs and symptoms of a heart attack that men do. More commonly, women just present with weakness and fatigue and kind of flu-like symptoms. They don't have the classic pressing chest pain or tearing chest pain that men do, and so we have to be a little bit more investigative with these subtle symptoms when women present with that. They also sometimes don't have the same EKG changes, or they're a little more subtle EKG changes when we do an EKG on these women. In fact, 60% of women experience no chest pain at all. So I'd like to encourage women. What you can do for your heart health is basically what we always say, is know your numbers. Know what your blood pressure is, know what your heart rate is, know what your blood sugar is if you have diabetes or think you may have diabetes, know what those numbers are, plus know what your cholesterol level is and your triglyceride level is, and ways that you can control that with diet, exercise, and hopefully if you need medicines, we can get you the medicines that can help you control those.